Good morning, everybody. This is Karen Palmer. I'm a certified professional coach, a food allergy mom and advocate, and I welcome you all to For the Health this morning. Linsey Davis from ABC will hopefully join us in progress. She's having a few technical difficulties, but we thank you all for being here with us this morning. This is For the Health, as I mentioned, a conversation on race and food allergy. And I'd like to take a moment to thank the sponsors for this webinar, Thermo Fisher Scientific, Alerje, Spoken, and of course, Emily Brown, who is the reason we are all here today, and her organization, Food Equality Initiative. Our goals for the next hour are to talk about what technically are called the social determinants of health as they relate to food allergy and the Black community. We want to be able to give you all resources that you can implement immediately to improve Black lives, to be able to show how allies and industry can support the organizations that are represented here today and others that may also be of interest, and create an inclusive environment and break down the silos that currently exist in the food allergy movement so that we can show that this is a disease that affects everyone.
Sorry, this technology is a little challenging time for all of us. First, I actually wanted to just kind of talk about what a year 2020 has been. Right. And this is further evidence of that we're all becoming savvy with blue jeans and Teams and Zoom and all of that. And we're just at the halfway point at this point. And it's really been this perfect storm of pandemic and protests of COVID-19, really underscoring the racial disparities in this country when it comes to healthcare and access and resources. Of course, the death of George Floyd leading to this racial reckoning. But the hope is, right, that perhaps through all of this suffering, we're finally going to see some change, and some change that would also apply to the racial disparities that we see in food allergies as well. Our panelists are Dr. Lakiea Wright-Bello, a board-certified allergist and the U.S. Medical Director of Immunodiagnostics Clinical Affairs, Thermo Fisher Scientific. Try saying that 5 times fast. Javier Evelyn, he is the founder and CEO of Alerje, recognized in Crane's 40 Under 40 and founding team member at MedTech Color. Denise Woodard is the founder and CEO of Partake Foods. Thomas Silvera is president at Elijah-Alavi Foundation, Inc. Dina Silvera is a mental health advocate and the executive creator director at Game. And Emily Brown, of course, is the founder and CEO of Food Equality Initiative. So I'm going to now turn it over to Karen Palmer.
Thank you. Thank you, Linsey. So, as Linsey was saying, we've come together to talk about making real positive change for Black families who face very painful challenges and overwhelming stress in being able to get quality health care. Inadequate health care is a reality for many Black Americans, regardless of income, status, or educational background. And the pandemic has actually brought into very sharp relief how pervasive this inequality actually is. We have disproportionately high numbers of illnesses and death within the Black community. Now, the murder of George Floyd has actually focused the nation's attention on the public health crisis of police brutality, which also directly targets Black men and women. So in the wake of Mr. Floyd's death, Emily Brown thought about the racial disparities that led her to found the Food Equality Initiative. She decided that she wanted to share her feelings about that with the food allergy community, and that's what brought us all here today. So, Emily, would you share a little bit about what actually inspired you to write the letter?
Yes, I was inspired to write the letter really just by all of the things going on in our community, from COVID-19 to the loss of George Floyd. It really just made me reflect on all of my experiences as a mother of children with food allergies and the experiences I felt navigating the healthcare system and navigating our community as a mother of color and of children who bear a significant burden of this disease. And so that's really what inspired me to write the letter. And I've just been truly humbled by the response of the community and just excited about the conversation that we're going to have here today.
Thank you, Emily. A recent study published in the Journal of Academic Pediatrics found strong associations between race, ethnicity, and food allergy. And Black children are 7% more likely to have food allergies compared to white children. So I'd like to ask Dr. Wright, as an allergist and medical director at Thermo Fisher, in your role, what are some of the initiatives that you have to address the social determinants of health and reduce disparities in food allergy?
Yes, so social determinants of health are so important and often sort of under recognized. So two of my main passion, areas that I'm passionate about include access and education. And so I really want to, do my part. And it's really twofold. It's on the patient side and the provider side. So we want to make sure that patients from underserved communities have access to information about food allergies, and then, not only about the signs and symptoms, but also about, testing. And we want to make sure that they have access to allergy testing. We want to empower patients with information, and we provide high quality information on our Allergy Insider website, and we work with physicians who work in underserved areas. And we try to address issues that are relevant. So we have a blog where we talk about healthcare disparities, and my goal is to expand out, that content. And just to talk a little bit more about, working with providers in underserved areas, we also provide educational resources that are, directly applicable for them. So we perform educational programs to talk about specific IG blood testing and how to appropriately use the testing. We have partnerships with, federally qualified health centers in underserved areas, and there are, a lot of nuances about diagnosing food allergies. So we want to, serve as an educational resource, because there are nuances to the diagnosis and interpreting the testing. So we really want to be there for primary care providers, and we know that children of color with food allergies, they often don't have access to allergists, and or they may have to wait a long time to get in to see the allergist. So we really work with primary care providers to perform a lot of education. And so additionally, we do engage and participate in research studies, clinical studies, and it's really important that we work with providers and researchers from underserved areas as well, so that they can be included in the clinical studies, because we want clinical studies to be a reflection of, all children, including children of color, when this information is, disseminated. And so I'm very happy that, this article appeared in the Journal of Pediatrics. And so we have to remember to include children of color in clinical studies as well, so that when we get the data is representative of the, the whole food allergy community, including, people of color. And I also work with the African Heritage Employee Research Group at my job, and what we do is we also have a huge initiative to do STEM. So we want, children to know that they can pursue careers in science and technology. We also engage in lessons to, help facilitate that learning about science. And a colleague and myself, we developed a food allergy science education lesson and activity. And so we're hoping to disseminate that in underserved areas. And that's something that's really near and dear to my heart, because before I was a doctor, I actually was a middle school science teacher. So I think, it's a multifaceted approach, and it takes many people. And, I'm happy to be a part of this panel, because another initiative is to partner with nonprofit organizations that are looking for solutions to eliminate food allergy disparities. And so I'm happy to, partner with the Food Allergy Food Equality Initiative as well, and other nonprofit organizations with similar missions. Thank you.
Thank you, Dr. Wright. And now I'd like to bring in Javier. And Javier, I'm very familiar and wowed, blown away by your device where you can charge your phone and also give yourself a life-saving injection at the same time. So tell us, why did you decide to start Alerje, and what's new in technology to help end racial disparities in allergy?
So great to be reconnected once again. We got to take advantage of this Wi-Fi that we have right now, apparently. So good to be reconnected. So I personally suffer from a multitude of severe food allergies: pistachios, cashews, casein, kidney cheese in college. Lots of horror stories around that, right? No pizza. But historically, I had multiple family members that had backgrounds in healthcare, but I was really not a parent. Hard-headed, for lack of a better phrase, food allergy teen. My wife was saying I'm a hard-headed grown man. Every now and then I still leave the house without my epinephrine auto injector or just eat the wrong food. So really that was the genesis of it. Really me trying to scratch my own itch, and then we found there was an incredible market. So for me as a Afro-Latino, I'm Panamanian. Wearing both hats, ultimately I kind of let that be the root of the innovation, because our technology is not exclusive to, it's not just for Black and brown folks, it's for all, but it has, the genesis of it is really from an innovator that looks like the same folks that have impacted every single industry. So that's why we're so excited about the innovation that we have. So what we're up to is a redesigned epinephrine auto-injector that fits onto the back of the phone case. You take it off, use it, inject yourself, and it will alert folks so they know where you're at, what you're allergic to, and how to save your life in real time. And really, we just wanted to just build upon the lessons of other consumer products and take it into a food allergy life cycle and make sure that we can improve quality of life. One of the first grants or supporters we've gotten was through Code 2040, an organization geared towards equity, making sure that we get more Black and brown folks. Dr. Wright talking about the STEM program is really spot on. I'm somebody that learned later on in life as well too. But as it relates to the disparities in our space, we're hopeful that these conversations can really just highlight the innovations that we have, that Partake has and beyond, to really move the needle forward and really positively impact our community. So this is the fastest growing food allergy population, as mentioned. Dr. Duke has done some amazing work out of Northwestern. So it's not a matter of, this isn't a charity, right? This is a matter of good business, due to the fact that by 2040, Black and brown, or really the majority of the population would be Black and brown, right? So if we're thinking about other ventures, if we're thinking about forward outlook, I think it makes sense to get behind the innovators that, in addition to the others, that know the problem pretty well and reflect the population.
Okay, thank you. And now I'd like to find out about Partake Food and why Partake, why you decided to start Partake Foods.
Sure. So I spent the bulk of my career at Coca-Cola in their Venturing and Emerging Brands group. And my daughter came along. I'm surprised she hasn't photobombed what we're doing right now. She's 5 now, but right around her first birthday, we learned that she had several food allergies: corn, cashew, pistachio, eggs, I'm missing one, banana. And I was really frustrated with the options that existed. Not having any dietary restrictions, I'd always equated the words allergy friendly and gluten-free and vegan with healthy. And as I turned over packages, I realized some of those were nutritionally worse than the normal substitutes. And so, I found lots of sugar and starches and gums and things I couldn't understand that I didn't feel good about sharing with my family. From a taste perspective, there was some stuff that I felt good about nutritionally, but I feel like kids are the most honest critics, and my daughter did not feel good about them taste-wise. And the biggest impetus was I started to see how people who have food allergies and dietary restrictions are left out of so many fun social events. And while the brands that existed, I felt like did a good job of keeping people safe, I didn't feel like they were brands that really appealed to people with outside of the food allergy community. And so what I wanted was something that, pun intended, everyone could partake in and really enjoy safely. And so that's why I started the company.
Okay, and when the major food companies ignore the voices of the allergy community, you started that company. You're a small company, but managed to give back to the community with programs like Blessings in a Backpack, and more recently supported FEI with the Spoken Cares campaign. So what could industry allies do to help create a more inclusive environment for allergy advocates, would you say?
Sure. I think there's several things. I think everyone, not just those in the food allergy community, really educating themselves about what it means to have food allergies and what that life is like. I think there's a lot of misconceptions about food allergies. Like, you say something's allergy friendly and it just is nut free, but people are allergic to a lot of things besides nuts. You hear the term allergy free. Nothing's truly allergy free, because as you can hear from my daughter's list of food allergies, you can be allergic to nearly anything. I think it's through supporting organizations like Food Equality Initiative and the work that they're doing, because small businesses like my own, unfortunately, sometimes our price points are not the most accessible. So getting our products into the hands of people that need them and deserve them is really important, whether that's just spreading the word or providing monetary or product donations. And then I think also advocating for policy change and really like labeling requirements and things to make the life of people with food allergies a little bit easier and a little bit safer, or things that anyone can do.
All right, thanks so much, Denise. And now we'd like to bring in Thomas and Dina. You have used your grief, tragic story here to create a foundation and raise awareness with Elijah's Echo and Elijah's Law. Tell us about that.
Yeah, so instead of kind of like burying ourselves in our bed and just kind of like going through our grief, we decided to change and put more forth our passion and love into advocating and creating legislation that focuses on children, especially young children who suffers with food allergies and anaphylaxis. So with we kind of like worked very hard to push in legislation and actually getting a law passed last year in September, and it's basically focused on food allergy education, emergency action plans, guidelines that implements like emergency procedures, and also for educators to be trained as well. This also requires the anaphylactic policy for children in daycare services as well. And we know there's like such a big disparities in the underserved communities that our mission and with our foundation is to make sure that we focus like mainly in that section. It's just like, I don't know, it's kind of like setting that there's so much information that can be provided to these communities, but it's not. It's more than just collecting statistical data and bringing out the information on the disparities, and especially in healthcare. We need to focus on just going a little bit above the numbers. It's actually going into the communities and focusing on the real issue and the real problem at hand, because we have to understand the cultural sensitivity that becomes like in front of all of this. And then, like I said, if the data is there, we understand that, but we need to go into the communities and actually bring this to them physically so they can understand the disparities and how we can bring the health promotions on food allergies and asthma and so forth within the communities.
All right, Karen, I'm going to turn it back over to you.
Great, thank you. Dina, what I would love to know is, you all actually made some history with Elijah's Law. I mean, being able to hold daycare centers in New York State to the same requirements that K through 12 school environments are required to provide. So, number one, claps up. That's a model for other states, and it is going leagues towards keeping kids a whole lot safer than they were when my kid went to preschool, like a decade and a half ago. What do you see as your major priorities for the foundation? What do you want to focus on in the next couple of years?
So currently right now, we are actually working on a program for children that we do believe will not only support the systems that they're under, but also it would support the parents, because each one teach one. And we know that it's really important that, yes, we can provide the training and services that the administrators and the teachers need, but we also want to get the children involved. And even though that they're babies, the parents will now be involved. And so this program allows parents and child to have this communication that is happening. And then they can also take that outside of the daycare and the early child care centers, right? And back into their communities where they're having this dialogue with the people in their community about what they're learning. And they can even, it's palatable. It's a way that they can actually start talking about this very broad topic that maybe sometimes this is the first time they're ever hearing anything about it. And it's not just only for children who have allergies, it's also for children who don't, so that this conversation continues to happen, because we have to protect each other. And so that's something that we are really working on right now myself, and I enacted a lot of the peers to support and help that. Also creating programs like workshops and events around educating our communities about what's really going on. We have, like I said, Partake foods, right? Foods that they can actually access, and not just feeling isolated, or eliminated. We talked about, like Javier, all the work that he's doing, and other people in the community that they're not aware of. They don't see people like us, right? So when you think that we don't exist, and then you try to come into the community with a conversation, at times enlisting others, we sometimes, kind of remove ourselves from the conversation or the table altogether. But it's really great that right now we're creating these programs and these initiatives. Like I said, our children program to really help our community start seeing us and valuing what we bring to the table, to not just only support them, but also keep them safe and healthy.
You know, I stress this, like, I think I mentioned this before. It's like, you know, it's good that, you know, we have companies, everyone that want to see us of value, but we've always been of value. And it just holds very strongly to what each and everyone here on this panel is discussing, how the disparities are, it's not just now. We're not just seeing it now. It's always been there. Is that the way the community, the way the world is moving, we're now accessing that. Everybody is accessing the information. So now it's a spotlight. So now we have to make changes.
No, I mean, this is all wonderful information. I mean, the fact that you all are focusing on community building, not only a logical next step, but extremely necessary. I've done a lot of work in schools over the last decade, so I can certainly tell you that a lot of our parents are not well informed about what it takes to actually approach life with a food allergic child. And so the work that you'll do in that lane is going to be hugely important. And clearly there is a lot of work to be done at the, you know, local, state, and federal levels along the way. So thank you for your powerful and effective leadership. I know we're going to be looking forward to seeing what happens next with the foundation. Emily, I wanted to ask you, given what we've just heard Thomas and Dina talk about and all the incredible efforts that are being presented by members of our panel, what can interested individuals, people who are listening to this program this morning, and other organizations do to be effective allies, you know, towards reducing this racial disparity in food allergy?
I'd say the first thing is what you've done today, you know, taking a step toward educating yourself on the needs of the community and recognizing the disparities that exist currently within our community. So, you know, I applaud everyone who's joined this panel today to come beside us and to learn. Also, I would say continue to educate yourself. You know, Allergic Living published a wonderful catalog of all of the research articles around disparities in food allergy and asthma. So I encourage everyone to continue to put forth effort to learn and to make sure that you're aware of the challenges that exist, because we can't solve any problems if we don't know that they exist.
Absolutely.
Two, I'd say support Black-led organizations doing this work today. So support Food Equality Initiative, support Elijah-Alavi Foundation, not just with your likes and, you know, calls for solidarity on Facebook, but support, you know, that support means making a commitment to ensure that these organizations that are doing the work and have been doing the work have the funding that they need to really make significant impact. And to that, I want to say that Food Equality Initiative has just launched the 7% Fund and Coalition. And this is an enormous effort to raise the funds that we need to really close the gaps on racial and economic disparities in food allergy. And so we have a bold goal. Over the next 7 months, we are looking to raise $7 million, and that is to continue to provide education around these disparities and to expand the reach of our box delivery service. So making sure that everyone has the resources they need, including access to safe food, education, and then looking at those policy changes that we need to work on together. So supporting the research activities specifically geared toward disparities, and then working together through that coalition with industry and community partners to really push the needle forward. The only way we're going to get there is if we come together and we're intentional with our resources to make it happen. So
absolutely,
we're excited to do the work.
Yes. Well, that is a great to-do list to start with. So thank you for laying that out so clearly for everybody. And thank you for everything you've done to improve health and end hunger for people with food allergies. I know there'll be a lot of folks who are going to be reaching out to you to figure out how they can be helpful down the road. What we wanted to do now is to take some time to answer a couple of questions from, folks who have been, interested in what's going on here this morning. The first one we have is from someone who identifies herself as mom of teenage boys with allergies, who is asking, this one is for you, Javier. You've developed this app, and she would like to know, is it a good resource for kids as well as adults, and what makes it special if kids, would like to be able to use it?
Yeah, absolutely. Can you hear me?
Yes.
Okay, good. Make sure. But no, totally. It's for all ages. Number one, I think there's lots of good programs and different apps that are out there that do different things well. I think what we do special is just really making sure we just get straight to the point. So there's a couple of different things. We just released a new version of our app on iOS and Android with refreshed UI UX, and it really is going to help to keep those teens engaged, one, and also especially for kids that are away from their parents, whether it's at school, whenever we can get out back to school for the most part. We introduced a food allergy diary that you can tap or update in about 1 or 2 taps, right? So you can better discuss things with allergists and make sure that there's a lot more consistent data. Data is what we know about the app, and that's available on both platforms. And as per Emily, we're here because we have to make both statements. The more resources we continue to get, we can fast track our innovation as well too. We're looking forward to matching the enthusiasm and the love and the likes, as Thomas said, with the dollars. And once that happens, we can do some really special things.
We talked with Thomas and Dina a little bit about their priorities as well. Would love to know what next steps are for you in terms of what you'd like to be able to do and how people can help.
Absolutely. So for myself, the way I look at it, we're in a position where the innovation is there. So I think where the internet kind of cut out was that once the likes, once the momentum, the enthusiasm matches the dollars, we can do some really special things as it relates to the innovation. We're pretty close to that. So I would say we may have some special announcements opening up to the community pretty soon. I'll say that much.
Thank you, Javier. The next question is for Dr. Wright. And this one says, I'm a new allergist. So it looks like this person is a new person, a young person in an office full of older physicians, and feels like they're in a sensitive position. How do I raise the issue of dealing with racial disparities in food allergy with these other physicians in my practice?
Yeah, I think that's a great question. I think it's really important to, I would say, lead with data, because it is very hard to talk about sort of race for some people, and it can be an uncomfortable conversation. But as many panelists have said, we have to acknowledge the problem in order to affect real change. So I would say a non-threatening way to bring it up is to actually discuss the data. Emily, you mentioned the list of articles on health disparities. If that practice doesn't have a journal club, perhaps making an informal journal club, perhaps over lunch or even virtual lunch, and talking about that data. And then also examining your own practice, because we know that specialties, including allergy, and I'm an allergist, and they don't historically accept Medicaid. Not all practices accept Medicaid. And we know that in the US, people of color are disproportionately living in poverty. So we have to ask ourselves, how can we affect change? And it could be on an individual level. In fact, it needs to be on an individual level, because together that would make a huge impact. So you can also look at your practice, look at your data. Am I seeing diverse patients? If not, what can I do about it? And one simple thing is, perhaps you can accept Medicaid on certain days or once a month, or perhaps you can volunteer your services at a food, you can volunteer your services to see food allergy patients or allergy patients at a federally qualified health center. You really have to look for ways to make change and have those difficult conversations about racism, racial inequality, and ask yourself, how can I make a difference? Additionally, if you engage in research, you need to include diverse populations so that those results are reflective of people of color as well. And I think those are some good steps to take.
No, that's wonderful. Thank you, Dr. Wright. I think, people are talking a lot more about race in general than they have in a long time over the last couple of weeks. It's painful for some. It is completely foreign, frankly, for others who've just never felt the need to address it in their personal lives. And so giving folks ways into this conversation is really important. All of those steps are amazing, fodder for any medical folk who might be on the line. I think we could also, all of us, get behind recommending some sources from our own community, like Allergic Living, which has been, really an incredible place to go for information for folks who are just at the beginning of the process and trying to figure out, as you point, the data, and really dealing with the process of living and working with food allergy, and then helping to accommodate other people who may be in your sphere, whether that's home, work, community, who are dealing with these issues. So thank you so much for that. I think, Dina, I have a question for you.
Oh.
This one is from a woman who says, I'm a Black mom and I have a young child with allergies. How do I make sure that my voice is really being heard by schools and caregivers? I feel like people think I'm being dramatic.
That's a great question. One, you're not being dramatic at all. You want to make sure your child comes back home safe. So no, never feel like you're being too much. Never feel like your voice is too big, and never feel like you're being dramatic. So that's that too. Ensure that you have the medical forms that you need that are completely filled out. Because yes, data is important. And so a lot of the times that cuts that feeling of you're being too much, right? So that's one. So you can always lead with my child via these forms that I have filled out. And this school states that they're going to represent and make sure that my child has a proper care in which that they said they can provide. I am asking for these things, right? We have to always make sure that our tone is stern, especially when we're fighting for our children. I notice a lot of times parents tend to try to come into this conversation with the administrators or the teachers or anybody that's in charge of their child in a very, very timid and mild way. And we cannot do that anymore, because just like we discussed race as being a topic that people are having a conversation about now, this is also new for a lot of people. And when change is happening, sometimes it can make people feel like you're attacking them, right? And so this is the time for us to truly use our voice as parents, particularly because we have to advocate for our children. And you want to make your presence, and I have to say this, you have to make sure that they understand that your presence is felt even when you're not there. I'm going to say that again. Your presence needs to always be felt, even when you are not in that building with that child. Absolutely. And the best way for us as parents to do that is to use our voices as strongly and sternly as possible, especially when we have children with food allergies. So never give up. You're going to probably sometimes feel like you're the only person in this fight, but trust when I tell you there are other parents that are quietly paying attention. There are other administrators and other adults in that building that you're actually teaching how to stand up and protect those students and those children in that space. So don't give up.
No, that's, an amazing observation. Your voice has to be strong because, if you're not advocating for your child, who will?
Absolutely.
The other thing that I would ask related to that is, in this process, where should these parents start, like in terms of who can be the most effective advocate up front? Where should they target their energy? For example, if they're dealing with a new school or, a new community activity.
So particularly, so when you're talking about either like public schools or government grant programs and such, they tend to have somebody who's actually staffed, right? Be clear, be sure to make sure that they do have a nurse, find out how often they are in the building. Sometimes a lot of parents don't know this, but they're not there every day, right? So in a week, they could probably only be there twice. So make sure you get that information. Also, if your child does not have an IEP, make sure they have a 504. Talk to somebody in that office to find out who is in charge of making sure that your child's needs, their special needs, is always attended to. So whether you have those medical forms filled out, 504s, because IEPs and 504s are kind of the same, right? So you never generally want to have both. You most times you won't have both, right? So it's either one or the other. And IEPs, to me, I feel like is more comprehensive because it can not just take care of your child's medical needs, but also the academic needs. So I generally push for the IEPs. And so you want to make sure that when you're talking to the individuals in that administrative office, you're very clear on who is going to be the one that's going to be taking care of your child's special needs, because it varies. If you're in a daycare, the systems are really different. If you're in an early child care center, it's very different. And it's a lot of information. It's very convoluted. And sometimes I think it's done on purpose. So it makes it a little confusing. So you really have to make sure that you're asking for the proper paperwork. Crazy, you have to some people don't know what a 504 is, right? Some people mix up 504s with medical forms and IEPs. And some schools don't even take 504s, but it doesn't matter, because as long as you have a medical form, which is a legal document stating that these are your child's needs, they must adhere to them. So it's important that you get that all down in writing. You actually see the person that will be taking care of your child, and that you're clear on how often this will be happening. Because it can be a nurse, it can also be somebody that they hire, like a paraprofessional or medical paraprofessional, that's going to sit with your child on a daily basis. So you want to make sure you have all of that information up front before making a decision.
No, that's fantastic, Dina. Thank you so much. I think that process can be really overwhelming for parents. You know, again, you're learning about your child's food allergy, you're trying to figure out how to manage it. And then all of a sudden you realize, wait, I've got to take them out to school. I've got to take them to, you know, church. How am I going to deal with this? So really, really useful knowledge for folks who need to develop a whole new support system.
Absolutely.
Pretty much everybody on here has talked about this is a unique moment in time, a unique opportunity where people are talking and acknowledging, you know, racial disparities, whether it's social or economic or, you know, even in the dietary and nutrition world. And so how do you harness this moment? I mean, I think in some ways we've been talking about specifically what parents can do, but as far as newfound allies and advocates, what are some steps that people can do right now that are going to make a difference, that are going to spark change, to give people like tangible steps that really want to raise their hand and say, I can help, what can I do?
I will definitely say, I like these questions. One, money, because a lot of the time we know resources are very limited in our community, right? It's not that we don't have the ideas and we don't have the ability to do other things. So that's one. Two, also finding out who's doing what, right? And being clear about what you can actually support. So a lot of people say, ask me whenever I'm here, but if you are someone who's dealing with, like I said, food, right? And most of your resources primarily has to do with food, and your money's that's donated and allocated to that space is only for that purpose, right? Because people will tell you how to use the funds when they're donating them at times. So when you're saying that you want to help, make sure that you're aligning with the programs or the organizations that you can actually help, right? I know that everybody wants to help, but it doesn't make any sense to reach out to a researcher like Javier, but you have no resources to actually support. So then it doesn't even appear as though you're really trying to help. You just want to sound like, can I say this? Sound like you want to help, just to say that you want to help, but you never intentionally thought about how you're going to do that. So we need to start with the intention of where I am in my organization and what I can actually provide, and then do the homework and the research to find out who are those organizations, those foundations, or the support systems that I can actually provide the resources that I actually have allocated to me to support that space, if that makes sense. Because we all can't, everybody has their own separate lane, and we all have to be able to provide that. So if it's not money, it's products. Do you have products that you can provide or give and offer to this particular organization, foundation, or service that they can provide to their communities? Is it your time? You know, can you actually take the time? Because people a lot of the time assume money is the answer to everything. Sometimes it's just your presence, showing your solidarity in that way. Also, it can be aligning your partnerships or sponsorships, right? Or people that you know, your angel investors, you can offer that information, right, to these actual spaces as well. So it's a lot of times you don't have to take the onus on top of yourself. You know, like for myself, I can say, you know what, I know somebody that can get this done for you, if not me. So those are real actionable ways to get things done, you know, as opposed to having a meeting for a meeting, and then we end up hearing in the end, oh, you know, I'm not able, you know, but you know what, if there's anything else you need, please don't hesitate to call or reach out. No.
I would like to also add, I think it's also amplifying the voices of patients of color. I think I expressed this very poignantly in my letter, the feeling of being ignored and not having visibility. I think what's so great about this panel today, we're seeing so many beautiful faces of color that are leading the way. And what a wonderful example that is. to so many of the families who are struggling with this issue, but have not yet seen themselves, that have not heard a Black voice talk about this issue. And I think representation does matter. And so when I think about what can be done, I mean, we've talked about these broad concepts of, diversifying research and all those things. Well, what will it take to attract Black patients and patients of color to participate in research? I think part of that is seeing other people that look like them in this space, in leadership. That's one of the reasons I call out, patient advocacy organizations, academic and clinical institutions to do that diversity and inclusion work. What does your senior leadership look like? Are you, are you working to attract physicians of color to your practice? Because I do think that, we all know that there are documented biases and lots of challenges, structural challenges we have to overcome. But I think it starts with representation and, and voice. Visibility and voice, I think, are so important and something that we can do now. And again, amplifying those voices, not always speaking for patients of color, but asking them, what do you want? What do you need? How can we be an ally and support you? That starts with listening, which is why I think we've started with this conversation with notable Black voices, because I want you to hear the stories of Black families and Black patients dealing with this issue, who often, when you look at, the feeds of many prominent organizations within our space, you don't even see a face of color. So I think having true representation matters.
Can I chime in on that real quick? Just to piggyback what Emily said, I think she hit the nail on the head when she said having true faces of color. We all represent a space that we're passionate about, and this is the life that we live. We use this phrase, I didn't choose to be Black, I was born Black, and I love it. And, it just sets a precedence of like who we are and what we're doing. And it comes down not to just the statistical data that we're all seeing. We have to understand the cultural sensitivities by having people of color go into these spaces and do the analysis and work within the communities so we can see it. Like, it comes down to the health promotion and the cultural sensitivities, that it is a language that many people don't understand. If you don't understand the culture and the communities that you're going into, you're not going to be able to go into that space comfortably and see it, because you will be ousted because they won't trust you. So if you bring in someone who is a cultural appropriate to those communities, and that face is similar to theirs and their language and everything is similar to theirs, then there's that comfortability, that the trust will be built, and then you will get the service and the acceptance that is needed. So again, Emily, thank you for highlighting that.
I just have one more, because Emily, you used the word overcoming, and while I was overcoming my technical difficulties off the top of the program, had I not, I would have started out with saying Happy Juneteenth. Yeah. And I think that as it's by no coincidence, I'm sure, that this is taking place on Juneteenth, and as we celebrate 155 years later, I think, the pursuit of freedom continues, and that word, that idea of being free, is a really big word. And so as we talk about resources and access, I just wanted to flip really quickly for parents, for Black and brown parents who their children struggle with allergies. How do they get the education and get the resources and the access? I
don't know. Can I take this, guys?
Yeah, you can take it.
Yeah, so again, it's like there's so much information that is out there, that especially when you're searching on the internet, the resource is there. But if you're looking for more of a space that is appropriate to a Black community or whatever, they can reach out to like Emily. They can reach out to my foundation, the Elijah-Alavi Foundation. We can go to Lakiea with Thermo Fisher. They're focusing on these spaces that are important. So we have the resources. We can provide the education and anything there is to have these have the community feel comfortable when they want to access that information. We want them. Go ahead.
I just also want to add, a lot of the times we talk about disparities, especially in our communities. I just want to put this out there. There are Black and brown people, right? Ethnic folks like ourselves who do live in middle class spaces, right? And they have access to certain information. So when we're talking, a lot of the times, we're talking about the larger communities who don't have access to a lot of this information, right? And they don't have it, not because they don't want it, but because they make it so cumbersome to get to it, right? And we're so busy, we have to work. And so it's not that we beautiful people don't exist, but they don't even know that we exist because nobody's telling them, right? We are all educated people on this panel. We have taken the time to, educate ourselves on a lot of things. And so now that we have this information, now that we are free, right, we now have to go back into our communities and we have to give them that support that they need without even realizing that they need it a lot of the times because they do want it. It's just that, poverty and a lot of other elements that, contributes to why they don't have this information. It's not that they don't want it. And so what our foundation is, I can only speak for ourselves, and I know that there are other great people out there that's doing a lot of work, but what our foundation is hoping to do is actually work with medical professionals, right? Clinics, hospitals, doctors, people like Javier, Thermo Fisher, Emily, each and every one of us, and giving them that information. So when they come to us, they know that innovation is happening. They know that they can go to a place to get food that represents people like us because like my husband was saying earlier, a lot of the times I've worked in education and I even noticed that there are times when I had students that did not look like me. They did not want to communicate certain things with me. And I would have to get somebody so that they can understand this is a trusted environment. It's a safe space to share out. So that's the same thing with what we're hoping to accomplish in this space, where when they come to us, we can help them to identify the places and the people that they need to go to in order to get support. Down to Medicaid, right? If we're going to talk about that. When I have to look for doctors, I have to do my due diligence. I have to go online and search up zip codes that accepts my Medicaid, right? My health insurance plan in order for me to get proper care. I have to do that extra work because when I call, you know what they tell me? Go into this zone for support. And when I go into that zone for support, I don't see anybody that looks like me, and they're not giving me any information that supports my community at all whatsoever, right? So our foundation, that is the goal for us to consistently be that voice in our space. So anytime they're looking for information, they can certainly get it.
So if I can throw something out there, you've pointed out a critical need for supporting folks who are advocating in the way that you are within their schools and their local community organizations. So something perhaps that people who are on the line today can be thinking about is, how can I be an effective ally in supporting those people who are doing those ground level efforts to support people who may not have reliable internet at home or access to Wi-Fi and getting this information? Can I go to the principal to talk about what we're doing to increase that kind of access for people who may need to get what could be life-saving information for their families? Absolutely. So I think people can use their voices as allies. They don't have to think about, do I have to go to some completely new place? They can start right where they live. And that support is more critical than pretty much almost anything you can do. The other thing I wanted to point out is then Emily raising the issue of, what, Food Equality Initiative has been able to do through its efforts on the ground to end hunger for people with food allergies. I would also imagine, there are things for people to learn about, how does one establish this kind of setup? How can I make a food pantry local that's going to deal with some of the same things? I mean, I was amazed when I heard about FEI because I thought, why are more people not modeling themselves after what you've done? And so there's a wealth of resources, not just with the folks here, but with other folks that you all can refer people to be able to take this knowledge and take, as Linsey pointed out, actionable steps towards making it real in their own communities.
Absolutely.
I would agree. And I think it's also important to remember that when we're creating these spaces, and I think Dina said it as well, creating safe spaces and welcoming spaces. I think back to my initial journey, there were no support groups in the city. I would have to drive 45 minutes to the suburbs to participate in a support group. And I've often said food allergy community is just not accessible to patients of color, the families of color, and to those who are socioeconomically disadvantaged. So when we think about how we create support, I mean, we're now in this post-COVID reality, right? So much of the work is going virtual, which I think is going to help with accessibility to resources. But, I think beyond that, we have to think about how we make it possible to connect with the families who are most burdened with this disease, and how do we make their lives better, and how do we connect with them, and I think the answer is being intentional.
Yes.
You have to be intentional.
All right, well, if all hearts and minds are clear, I think I'm going to begin to close us out. Emily, unless you have any objections to that. I mean, obviously, this is a conversation that needs to continue, right? I mean, we're just starting to scratch the surface here as far as race and food allergy goes. So please keep an eye on your inboxes for materials from this webinar and an invitation to our next For the Health conversation in July. By then, we're going to be a well-oiled machine. We're going to have all this Zoom and the technology and all that down pat by then. But we want to thank our panelists, certainly, for their support, our sponsors, Thermo Fisher Scientific and Alerje, and also Partake, Emily Brown, and the Food Equality Initiative for bringing us all together. We especially want to thank all of the families living with food allergy. We hear you, and together, our actions today, tomorrow, and the weeks to come will certainly and very hopefully reduce racial disparities in food allergies. So thank you all so much for joining For the Health, a conversation on race and food allergy.
Thank you.